People's opinions about marijuana have changed a lot over the last few years, especially now that marijuana is legal to sell and use for medicinal purposes or even recreationally in many parts of the U.S. Kids and teens may think it's harmless. According to the National Institutes of Health, more than 45% of teenagers have used marijuana before graduating high school. You may have used it when you were a teen yourself, so it may be hard for you to talk to your children because of your own history.
But marijuana isn't harmless, especially for young people whose brains and bodies are still maturing. Marijuana is an addictive drug that affects brain chemistry in ways you cannot predict nor prevent. It contains up to 20 times more tar than tobacco, which irritates lung tissue and can lead to respiratory problems. Using marijuana causes memory loss, impairs judgment and reaction time. It can even lower a person's IQ over time. Plus, it's a lot more potent than it used to be. Today, marijuana can have up to 30 times as much THC as it did in the 1960s. This makes even first-time users more likely to experience adverse and unpredictable effects like anxiety, hallucinations, and even psychosis.
It's important to start talking about marijuana with your kids by the time they enter middle school. Ask them what they know about marijuana and be ready with the facts about how it impacts people physically and mentally. Make it clear how you feel about marijuana and set firm rules and expectations for them to follow. Help them develop ways to handle peer pressure at school and social situations. And most of all, keep the conversation going over time so they can ask questions and get your support as they get older.
The number one reason kids don't use marijuana is because their parents told them not to. Even when they don't seem to care what you think, they do.